Welcome back to Top Doctors, Stories Behind the Summit, our special interview series ahead of the Global AI Summit in London, June 2026. I'm your host, Anna, and today I have the honor of introducing one of the world's foremost voices in dental aesthetics, Dr. Ahmed Hamid, Director of the British Centers for Excellence in Dentistry and the Saudi British Medical Forum. Dr. Hamid is internationally recognized not only for his pioneering clinical work, but also for his leadership roles across Europe, the Middle East, the United States, including as regent of the International Academy of Dentofacial Aesthetics in New York. Dr. Hamid, it's a privilege to have you here. Thank you for joining us.
Thank you very much. Thank you, Dr. Oldak, for this introduction and this opportunity to share your reflection on these topics, which are shaping the future of medicine, actually, AI ethics in healthcare.
Exactly. Thank you so much for being here, for making time for this interview. It's a true privilege for us. You've built a remarkable global career in dental aesthetics. Let's start with your AI journey. What AI tool or innovation have you used that has made the biggest difference for your patients?
I think the AI now, it's not only coming into everyday life and everything, not only in dentistry, but in the medicine as a whole. But when I started actually in the year 2000, I was the first to set up the first fully digital dental center in the Middle East, in Riyadh, in Dalla Hospital. And gradually, I was also the first to introduce the digital scanner in the Middle East. I was the first to introduce the CAD CAM. Also, I was the first who was to introduce CAD CAM to the Middle East, and I helped setting up some of the most AI advanced in the orthodontic, aligners in the Middle East, and also setting the first Saudi dental AI software that could detect dental caries, dental disease, and also using the neural network to detect the early signs of leukoplakia and oral cancer.
That's excellent. What inspired you to start using new technologies?
I think since my childhood, I was always looking for something new. And I remember my first trip into New York, I saw it was like in the early 80s. I was seeing like a big queue in front of a newly opened shop called Apple. And I asked the people, what is it? They said, oh, they have something called iPod, a new machine, music player. So I joined and I have the very first iPods introduced to the UK and to the Middle East.
Oh, wow.
So that was my sort of, and I do believe that nowadays with the AI is not what it can do, but what it should do, to add the human element, to add the empathy, to add the transparency. And that's why I'm giving a lecture on the Dental and Medical Summit conference in London next year on dental ethic and medical ethic AI, the relationship between AI and ethics in medical and healthcare.
Exactly, about that. And at the London AI Summit, you'll be sharing your experience with peers from around the world, basically. And so you mentioned a little bit about what are you going to talk, but what will you be demonstrating for other doctors at the event?
Well,
without revealing too much.
I'm wearing two hats in that conference. I'm giving a presentation on the ethics in AI healthcare, how to implement ethical concept. And I'm going to focus on in Saudi. And in the year 2019, Saudi Arabia was the first country in the world to introduce a philosophy of ethics in healthcare as well as the AI is concerned. And this is what's produced by SDAIA, which is the Saudi Data and Artificial Intelligence Agency. Was the first country in the world to introduce. There was a big medical and AI summit actually was in Riyadh, which I proudly helped in formulating this document. And this document is really issued the world first national framework dedicated to the AI ethics in healthcare. This wasn't just a simple document. It was a philosophical statement. This just to emphasize the fairness, transparency, privacy, and above all, the dignity of the human being at the center of the care as far as the AI healthcare function, whether dentistry, whether surgery, medicine, all branches of medicine. And the other hat I'm wearing, I'm also running one day, which is the Anglo-Arab Healthcare AI and Healthcare Summit, where we invited all the, if you like, what we call them in the UK, we call chief dental officer or chief medical officer. It's like in charge of the healthcare. I don't know in Holland what you call the man in charge of the whole sort of medical within the Department of Health, and inviting their counterpart in the Arab world, which is, we call them general manager of health directorates within the Ministry of Health, and their counterpart in all the 21 countries. So to share information between UK and the Arab country as far as the AI in healthcare. As I know that we in the Middle East, due to the history of the colonization of Britain, all the medical and dental school in the Arab world was established by British professors. So there is a huge link between this country and UK. And that's why we decided to do this summit in London. And we're hoping to present the London Accord, another document, important document. We're going to review, I'm not going to say anything, but it will be another philosophical statement as far as the AI in healthcare.
Oh, that's amazing. And what a great link you are between these two continents and between these two worlds. Could you maybe explain what would be like if whether you recognize a difference in a usage of AI in Europe and in Arabic countries, or I believe you've got a lot of experience in the US market as well. What are the differences in the development of AI?
I think as far as the AI in healthcare, let's focus on the healthcare. It used to be the United States is the leader of AI in healthcare. Unfortunately,
Exactly.
this
Yeah.
is not the case anymore. China now is leading the way because in Europe and in the States, you have the HIPPA and you have the GDPR in Europe, which limits how can you use data. In China, they have free hands. They have billions of data as far as the health informatic, and they don't have regulation. And because of the limited number of medical personnel in China, so they had to spend billions and billions of dollars on their AI in healthcare, and they are now leading the way. The beauty in the Arab world that we are using the brain of the American and European, which is number one as far as the AI, and the logistic and the software which is available in China. So we are using the best of both worlds. And there is a big difference. If you remember, I mentioned, you asked about the difference. As far as there was a Google Health, they introduced a program to screen the breast cancer for women.
Yes.
Using algorithm that can detect it very early. Unfortunately, this algorithm was based only on Caucasian. This was an American, only on Caucasian women. So when Afro-Caribbean woman was placed in this algorithm, they missed a lot of neoplastic cells and led to few deaths. So you need to have your algorithm to your nation, to your population. because there is a racial difference as genetics is in Holland is not the same as in Saudi Arabia. It's not the same in the United Kingdom. It's not the same in New York or in any American state. So really, you need to have your algorithm based on data from your own population to be fully representative and to be fully curative to the problem we're facing. So I think it's very important that each country should have their own data algorithm in order to be successful as far as the AI and healthcare.
Yes, absolutely. I understand. I am asking this question because at our AI summit in London next year, we are gathering professionals from both medical and dental world into one conference, but these people are coming from all around the world. And what a great link to be as yourself to have a chance to be the link of all of the world, to have experience in so many organizations, and also to see how does it work in different regions in the world. And about the summit, as one of the top 100 doctors, you've been recognized by your peers for excellence. How did this recognition come about, and why does peer-to-peer validation matter in medicine?
I think it's very important. I'm grateful to the Global Summit Institute for their recognition and for I think one of the 2022 was the first list of top 100 doctors, and I was in that list. I was privileged to be in this list. And I think it's very important that doctor and peer-to-peer recognize each other and recognize their achievement, and not being envy of the success of your colleague. You celebrate the success of your colleague, because the success of a colleague is a reflection, and it's a group success really. And I'm really honored to be also nominated this year as the Alan Turing Award for the 2025 of my involvement with the dental AI. And I think it's very important that we recognize the achievement. And I'm grateful, as I say, to the Global Summit Institute and for doctor to doctor movement, because it's now, talking now, we used to be 100 in the year 2022. Now we are reaching more than thousands and thousands. No,
Exactly.
it's a big movement now. It's an international, truly global movement.
We're growing each year, and what a great honor to have you, doctor, among us.
Thank you.
And congratulations on
Yeah.
on the nomination. What do you personally hope to learn from other top 100 doctors next year, sorry?
Well, I think I'm looking forward to this conference. I think it will be an outstanding global event that will shape the future of health, dental, and medical AI. And I'm looking forward to see the new developments from my colleague in other departments, because I could see the list we have now more than 50 lectures in this conference, and they're all beautiful. And I'm looking forward to attend and to learn all different about neural network and deep medicine and deep dentistry, which can already change the map of medical and dental world. And I'm looking forward really to continue this dialogue with my colleagues around the world attending this conference.
Yes, we should definitely stress that there's going to be not only dental professionals as the two of us, but also medical professionals. And as you just mentioned, that would be a great opportunity for networking, for exchanging experiences, for exchanging ideas. And that's only for good in development of medical health. And why do you think is important to attend this summit in London, and why is it so important right now for doctors to explore AI in healthcare?
I think it's very important because now it's, as I said in our first discussion, that we are not asking what AI can do. We are asking what AI should do. And in the near future, AI will not replace medics and dentists, but AI will replace medics and dentists who's afraid of AI. So
Yes,
medics and dentists who does not believe that AI will have an important role in our profession will be replaced by doctors and dentists who believe that AI is part of our augmented reality and part of our metaverse now. So it's very important for, I think, all my colleagues. I ask my colleague dentists and doctors to attend to explore the new reality that AI is an important part of the healthcare system. And if you don't believe in AI, in a few years' time, you will find yourself without any job. This is reality.
exactly. The boat is sailing off. We better jump on it, huh?
Absolutely, absolutely, absolutely.
In the end, what would be one piece of advice you would share with those who want to make a lasting impact in their careers?
I think it's very important to keep up your knowledge up to date. There is beautiful some courses, and I will mention one of them, Oxford University. They are running now basic and immediate and advanced AI courses in healthcare. And I do advise all my colleagues to attend. And before that, I think it's very important that you should attend our summit conference in London in June, because this will be a truly beginning. We are also inviting big names in the, one of the big names. And I'm hoping also to get some member of the both British and the Saudi royal family to attend this conference.
Astonishing. Dr. Amit, thank you for sharing your insights and your experience and your vision for the future of dentistry. It's been an absolute pleasure to hear from you. And
Thank you.
for those listening, you can meet Dr. Amit alongside many others extraordinary peers at the Global AI Summit in London on the 26th and 27th of June 2026. We will share the link for registration in the captions in this video. And yes, until next time, I'm Anna, and this was Top Doctor Stories Behind the Summit. Thank you so much, Doctor.
Thank you very much. Thank you, Lisa. Thanks.